Good afternoon, guys. Good afternoon, guys. No one has tuned in yet, but I know you're gonna tune in. But I guess this is going to be a very hard conversation because we are supposed to be talking about those facilities that are not treating their healthcare workers right. So that is the conversation that we are supposed to be having this afternoon. So I'm still waiting for guys to tune in. You can, those of still tuned in can share the link in just a moment. I'll be back. So when we talk about the shit list for healthcare facilities, and by the way, just before I proceed, if you're watching this video and you've not subscribed, then niseme nini, may some boy kushike hapa kwa makwapa, kushike hapa kwa makwapa, tuone vile itakuwa. Subscribe guys, subscribe. You have the comment section to air in your concerns, your contributions, and let's keep this conversation going. I remember yesterday when I said that we would talk about the shit list. Watu hii maneno ilichemka mbaya sana. Watu wakasema now this is not the conversation that we want to have right now. You know, we are not ready for this because we are thinking that hatufai kuharibia wengine biashara, lakini kama hatutaki tuharibie wengine biashara, mbona watu wengine wanaharibia wengine maisha? You know, healthcare workers have been trained, and you know that training very rigorous. Thank you, Kibanya. Thank you. I've seen your comment. Healthcare workers have been trained properly in Kenya. We've been trained. Alafu imagine kupitia hiyo pain yote, and then you get out here to a facility that does not pay you. I mean, we are saying that we are not ready for this conversation, but I'm saying that we are ready for this. I'm having a few facilities that niko na evidence nimetumiwa. I'm going to name you. I'm going to name you today. I'm going to give out your names, that healthcare workers avoid working for you people because you don't pay. Niko na evidence, and I think a few of you nimewapatia time ya correspond to those claims by your former employees, former staff. Some of them are still working for you anonymously, and sijaona responses. So if you are an employer of healthcare workers, then I guess you need to look out for for these names. They are coming up big. So which facilities are supposed to be in the shit list? One, these are facilities that do not pay the right amount of money. You go to school for 3.5 years, 4 years, 5, 6 years, and then someone wants to pay you 12,000, 15,000, 10,000. Alafu mnaniambia hao watu hawafai kwa shit list, hawafai kusemwa hapa bwana. We need to give these disclaimers, and one of the things why healthcare facilities zinanyanyasa healthcare workers ni vile tunaogopa, hatutaki kuongea. Tunaogopa tukiongea. Someone asked me if I have a lawyer and is ready for this conversation. Yes, nitaleta majina zenu hapa, and healthcare workers will not come to those facilities to work for you. So if you're also a healthcare worker, you know, again, I think it's a nipatieni hapo comment section. These healthcare facilities belong to healthcare workers. So it's actually other healthcare workers that, thank you Samuel Itute, thank you Joel. It's the other healthcare workers that are actually oppressing the other healthcare workers, and then they don't want to be named. Hey, my friend, madha zenu zimeisha, mtakuwa mnakuja kwa hii list. Na kwanza, this show is going to be coming up every week. We are going to be having shit lists every week, and we are going to be naming facilities. So I was talking about facilities that do not offer fairable pay. You expect to pay somebody 10,000, pay somebody 15,000, pay somebody 20,000, and this person works from you from 8 to 5, from 8 to 8, or from 7 to 7, or from 7 to 8. Mbona usikwe kwa shit list? Huh? Mbona usikwe kwa shit list? Or somebody works for you for more than 8 hours in a day, but you don't pay them overtime. If you're paying them overtime, then you're paying peanuts. Huh? These are facilities that we have to name. The list is coming up. Just be patient. In a bit. I'm having a few that we are going to name. Now, the other issue is timely pay. Someone works for you for a cool 30 good days. 30 days. A whole month. Coming to you from 7 to 7, from 7 to 8, from 8 to 5. And then ikifika kulipwa, mara sijui NHIF, mara insurance haijalipa. Sasa salary itachelewa mzee. Salary itachelewa. Do landlords know that salary imechelewa? Some of us stay in houses that you default rent by just a day. Your door is locked. These facilities have to be in the shit list. So when a healthcare worker works for you, he has to be paid on time. And when should a healthcare worker be paid? You've got contracts. I mean, even some county governments, tutaziname hapa, they don't pay their healthcare workers properly. And I'm telling you to come for me. Hakuna pali mtanipeleka. Leteni out lawyers wenu, because I've got the evidence. Na some of you nimewatumia nimewatumia hizi issues ili mrespond. You haven't responded to date. I mean, if you don't pay your healthcare workers on time, we are going to gang up and we are going to tell them not to report those facilities. Then, some of these working conditions are just outrageous. Someone tells you to work from 7 to 8 and then 7 to 9 in the night. Lakini pay hairesonate hiyo masaa unamfanyia kazi. These people have to be named. They should be shamed. I think one of the reasons why you guys are getting oppressed by these employers is because you don't want to unify and give them. I know of a facility that currently they are having my request to respond, that has currently responded, advertised several positions. Lakini wenye wametoka hapo to date, wametoka hapa I think two, some about a month, some about 2, have not been paid for the last almost 7 or 8 months. Some of them 6 months. Hawajalipwa. Hawajalipwa. Alafu mtu mwingine apply, aende pale, awafanyie for another how long? 2-3 months, ambiwe story over money. The 3rd month they're almost giving up. The 4th month they're giving up. Alafu mnataka msisemwe hapa, my friends. This time around mmepata mtu atawasema. Mimi nitawasema. I'll be the voice of these healthcare workers, and especially the medical laboratory practitioners in Kenya. Every healthcare worker will be catered for in terms of this general kind of conversions like this one. So I'm still requesting. I have a few people who have got to my inbox and given me the evidence and the claims that you're having. I'm still investigating some of them. So if I won't name those facilities today or tomorrow, then when you're too patient, I'm still giving them time to respond, or maybe time to pay you, because nimewambia either wa respond ama wawalipe alafu walete evidence. A facility in Kisumu takes mtu anakosa kulipwa, alafu the personnel takes away machine ya hiyo nini, ya hiyo facility, and then the guy is like anakuja kumreport ati ameiba. Kupe disagreement yao ni pesa, hajakuwa akilipa. Some of these healthcare workers, some of these actions, I don't support them because the legal implications might not be very good for you. But some of these employers deserve some of these things that employees do for them. Some of these facilities that we work for cannot even nini, au hata hawatuchukuli medical covers zenye ni za maana. Hata uchukuli medical cover despite the elephant work that you do, despite the fact that you break your back working for them the whole day, the whole night, hauna medical cover. Ukigonjeka, it's between you and God. Even that basic medical cover in their NHIF, they don't, they can't take it for their, they can't take it. You know, I've had a facility that mtu anamfanyia kazi and then by nature of this person's work, he is always on a motorbike. This guy deserves a medical cover, at least an accident cover. You know, the roaming medical laboratory technologists, the roving nurses, the roving clinical officers, they deserve accident covers. But what did this facility do? Hata NHIF hawakuwa wanamlipia hadi siku yenye alikuwa mgonjwa akaenda hospitali and akaambiwa, you know, NHIF yako haiko active kwa sababu haijakuwa ikilipwa. But this is someone who has been working. Someone who has been working on a motorbike. Sasa akianguka pale mbele na motorbike anajipanga. Na hata ile pesa analipwa. I think alikuwa analipwa somewhere around 24,000-25,000 for that work. Alafu akianguka na hii motorbike, so aanze kutumia hii 24,000-25,000 yenye analipwa kwa mwezi kujitibu. You people are joking. This list is going to be available here. We will be naming you, we will be shaming you. Kama unataka kwenda koti, enda koti. Kama unataka kwenda kwa polisi, mkuje mtushike. We will not relent. But these are things that have to be corrected. If you want to employ a healthcare worker in Kenya, 1, employ them with the right remuneration. 2, pay them kwa wakati ambao unafaa. Number 3, make the working conditions the Highlander, thank you for that. Make the working conditions very favorable. Number 4, if possible, wachukulie insurance cover. Na kama haiwezekani, lipia tu NHIF. You will not appear on this list. Actually, we will whitelist you. Lakini hizi facilities, let me tell you, zile facilities zenye zinaenda kuwa hapa na wataja majina. 1, those facilities that are paying healthcare workers less than 30,000 shillings on a monthly basis, you are going to be here. I'm going to say you. I have pay slips. I have M-Pesa messages and even bank transfer stuff. I'm going to name you. If you're paying your healthcare workers less than 30,000 Kenya shillings and some of these places are so difficult working, you're going to be on that list. If you're not paying people on time, you're always people always paid in arrears. Nalipwa salary ya November, ya February. This February, leo ni February date 20. Nalipwa salary ya December last year. I am going to name you. If you, and especially kama nimekutumia pale urespond na kuja respond, I am going to give out your name here, and we are going to put disclaimers. It's time healthcare workers get united, especially those in private. Unajua wale wenye public are a bit united because they're having a common employer. largely they have a common employer, lakini sisi wale wenye wamekuwa private are not largely united. So we are going to be united in this forum and name each and every facility that does not pay on that pays peanuts, that does not pay on time, that the working conditions are not very favorable. Someone can wake up and then fire you the way they want. Yeah, I mean, how do you wake up and fire somebody like hakuna sheria, alafu hamtaki tuwataje majina hapa, and those people, those same employees wakiwaibia, you come to our professional groups looking for them. The F word on you. I mean, if you're that kind of employer, not everyone. And those few facilities that cannot be able to just basically pay for NSSF and NHIF, just the statutory kind of things. Mtu anakuwa mgonjwa anaenda hosi anapata NHIF iko inactive. This is going to be a show. And I'm saying that this is just the beginning. It was an opening. I was just opening a Pandora's box. A Pandora's box that most of you do not want to open. Today I'm not giving names. I know you've been waiting for names. I'm not giving names, but Tuesday I am going to start giving names. So from Tuesday next week, every day, every Tuesday, every week, we'll be having the shit list show that will be lasting about 10 minutes, and we'll be naming facilities that as they get updated every week. So I'll be receiving reports. You people have my WhatsApp number, most of you. Just WhatsApp me the messages there. Just give me the evidence there. Then leave it to me to investigate and then expose. I will expose them for you. So every Tuesday at noon, we will be having the shit list show on this channel. So you'll just be tuning in. Even if you miss it out, utakuwa unaipata baadaye. Then every Friday we should be having new video uploads. Now, I'm looking for partners in this, and because we want to start looking at the real, I'm especially looking for the laboratory technologies. I'm looking for inspirational stories on medical lab professionals, those who have those who have made it. Lakini those who feel inspired by what they do in medical laboratory, even the other healthcare workers, kindly get in touch. You have my WhatsApp number. If you don't have, then the number is 0718 178 070. So most of the time, restrict yourself to WhatsApping. If I receive your missed call, I'll call you back. So you can give our inspirational stories, and again, we'll also be giving the technical bit of what we do to patients. We want to give out what medical laboratory is all about to the world. So sometimes patient anakuuliza hii test ni ya nini, nimetumwa. So I want people who can be able to break down this test in ways that patients can be able to understand, and you will appear in this show. So those new videos about the test, about certain aspects of professional practice in medical lab will be uploaded every Friday. So we are going to be having 2 days a week. That's on Tuesday we'll be having the sheet list show for medical facilities that do not pay, that do not conform to the labor relations in Kenya. And then on Friday we are going to be having the inspirations, the tests, the technical bits. So at the same time, I'm also looking for partners that will be able to grow this channel together. It's still a young channel, as you can be able to see from the number of subscribers, the watch hours. We're still not reaching the far that we're supposed to reach. So I'm also looking for partners in terms of if you're a supplier maybe of medical supplies, then unaweza nitafuta tuongee biashara on how we can be able to market your merchandise or market your services through this forum. So the number still remains the same. The number still remains the same. So I've given you a hint on the healthcare facilities that are going to appear on our sheet lists. and I am giving them the time to respond. They have this week till the end. On Tuesday, we'll be having the first uh, about 10, between 10 and 20 facilities, because I've already sent out about more than 20 um, requests that are requiring response from those specific facilities. So by Tuesday next week, we should be having individual names. I hope we are all going to be patient and kindly tune in and share. Let's share and let us subscribe. Like today, I'm looking for just 20 subscribers, 20 new subscribers. Let's get the subscribers to 1,200. We are at about 1,179, so they're about. So let's share. Let's share. And if you know that you're affected by what I've just talked about, get in touch with me. Get in touch with me. I'll be your voice. Na mimi sitasema wewe jina. I will not put your names that there is this staff in your facility who is complaining. There's this one. All these things will be handled very um, anonymously. Very anonymously. So that marks the end of today's session. I'm very sorry if you expected names today, not yet. I'm still waiting for certain responses ili mimi pia niwe safe nisiwaseme hapa bila kuwapatia a fair hearing. I'm also going to be a very fair person and listen to the healthcare facilities in questions and you at the same time. So it's upon you to bring up the claim via my WhatsApp number that you already know. Then I'll investigate, and then after the investigation is done, after I give them a fair hearing, those who do not have satisfactory responses will appear in our shit list. So until next time, guys, have yourselves a nice day. Keep doing you. Keep doing the calling, or keep being in the call, and serve your patients diligently as you are trained. So guys, thanks. And by the way, when you hawaja subscribe, kindly subscribe hapo chini. Subscribe and tuzoee kuwatch hizi videos hadi mwisho. I know kuna one of you who told me that my videos are very long, they don't have all the time. So pia mkinipatia feedback pale WhatsApp ama hapa kwa comments, tell me how long you want the big videos to last. So I thought 25 minutes is okay. So if you think it's too long for you, then we can always shorten. So I'm looking for people who will report the facilities. I'm looking for lab techs who will give us the inspirations plus the technicals. And then I'm looking for partners in terms of medical suppliers who are interested in advertising their products and services through this forum. So until next time, guys, thank you.